So welcome everybody. Welcome to our next webinar series. I'm Lucy Brown. I'm the Deputy Director of the Florence Nightingale Foundation Academy. And I have the wonderful job of hosting the webinar series, hearing from wonderful speakers, talented and experienced speakers from across health and social care. And today we welcome the Professional Record Standards Body. We're really fortunate to have a Chief Exec, Ren Healthcare, with us this morning. We've got our Non-Exec Director, Claire Sutton, as well as joined us, and Annette, as well as one of the nurse advisors. They're going to be sharing the wonderful work of the Professional Record Standards Body. I'm really proud to be on their advisory board as well, so thank you very much for having me. So particularly excited to hear from the PRSB today. I'm going to hand across to Lorraine, who's going to say some opening remarks, and then we'll get into the webinar. There will be time for questions at the end. If you don't feel comfortable raising your hand and asking a question, you can pop it in the chat box and I can ask on your behalf. And just to make you all aware, we are recording the webinar. So if any of your colleagues wish to catch up on this at a later date, please do share it with them, obviously for our members and alumni. And also just be mindful of what you do say or pop into the chat box as it is being recorded. So with great pleasure, I'm going to hand across to Lorraine. Thank you so much for joining us this morning. I think just on mute there, Lorraine.
Yeah, I spotted it. Morning, everybody, and thanks very much for that, Lucy. We're equally delighted and excited to be here. So really pleased to have the opportunity to talk to you a bit more about our work, and I hope we can live up to Lucy's expectations here. But it is really important. I'll let my colleagues introduce themselves as we go through the agenda, if that's all right. Probably will flow better. So if we could just move on, Athena. And again. So my job is just to give you a bit of context so you understand how the PRSB fits in the scheme of things. So we're a small organisation like yourselves. We're a not-for-profit community interest company, so we're independent, we're UK-wide and with some dabbling at the edges internationally, and our core purpose is to develop and support implementation of information record standards. So basically, what's the information that needs to flow around and about and between health and care settings, and how is that standardized, and how does that enable interoperability and ultimately better integrated care? That's what we're for. And I think it's been really interesting over, I've been doing this job for, pretty much from the start of the PRSB, which is 6 years or so, and how that's changed, that understanding in the time, and just the real recognition that, I think digital had a bit of a bad press and people were a bit turned off to it and saw it as a barrier rather than an enabler. But people's real growing understanding that actually data and information and that flow of information is care. It's a crucial part of care, so really important to all of us. So moving on, please, Athena. So how does what we do translate into care then? So in defining the standards and coming up for, basically in different situations, what are the information needs? That's what we're about. And we do that not in a room on our own, but with all of you. So thinking, who are the people who are the users of this information? And I'll talk a bit about our processes in a minute, but the way that we go through that is very collaborative and inclusive, so that ultimately everybody gets their chance to have a say about what should be in the standard, what's meaningful, what's useful to you, because ultimately you're the people using it, and it'll stand or fall on that. Moving on to thinking about how people use those records, whether it's a member of the public, self-managing more of their care, or if it's professionals in the process of care. And key to that, we very much don't see ourselves as like an academic institution that develops standards and puts them on the shelf to develop, to collect dust. We're very much about what can we do, with our unique setup and our member organisations to help get standards into practice, because we know that the results of that and the impact of that is phenomenal. We've only just sort of scratched the surface of starting to do that. The potential for it to improve care is enormous. Okay, thanks, Alana. This is very important. So I said that we're a community interest company. So a community interest company has member organisations who have rights. They're part of the structure of the organisation, so including yourselves. We were delighted when you joined a little while ago. We thought that was a real boon to our membership. But this is the most powerful thing about the PRSB. When we started off, we had about 25 members. We'd be sat around the table in the academy and we could all fit in a room together, and how the world's changed. So now, I was just telling Lucy and colleagues a little bit before the call started, people are just joining in droves. So, just recent members in the last few weeks have been the LGA, the optometrists, the Welsh Academy, the Scottish Academy. And this is the powerful thing. We can't fit all of the logos on a page there because there's so many, but the reach of all of those professional groups, plus regulators, plus the tech, the system suppliers and so on being represented, plus the patient groups, really good social care credentials and so on. Together, that's phenomenal. It's a really powerful force. And as Lucy mentioned, she's your representative at that group. And it's a really important role because it's the conduit between what we're doing and your organisation. How do we help each other on this agenda? So really important. Okay, next one, please, Athena. So this one is just to say a little bit. Some of you might have been involved in some of our standards development. If you haven't been, I hope you will be in the future, because it's kind of you clock it when you're part of it. It's much easier to understand what's going on and why it's important and how it all works. But basically, the message that we're trying to get across here is that to come up with something that's a national standard and that everybody adopts is not a light undertaking. And so we do it sort of reasonably quickly and efficiently, but really rigorously as well. So we research, we look at international examples, we look at what NICE guidance says, we look at what the suppliers are doing, where are we finding best practice and so on, and really thoroughly understand what's out there now, what's the need, what are we trying to do. As I mentioned before, one of the really important roles of our member organisations is helping us recruit people and get really wide involvement in the consultation, so it really is representative and a quality product. So we engage widely and typically we'll go through several cycles of iterations of coming up with the standard and what it should be. This and all of that works and is important. Even if you're on paper records, that's of value. But of course, the big bonus here is when all of this information gets digitized and it can flow around the system and be shared easily, and everybody understands the same thing, what the information means and how it can be used safely. So we also work very closely with colleagues in the technical world in NHS Digital and so on, who come up with those technical messages that allow the computer readable version of the information to flow. Typically, no standard is quite the same, but we'll pilot it and test it, learn more, by using it in practice. And then ultimately the standards are published. And if you look on our website, we've got quite a range of published standards. And another really important role for members is endorsing them. So actually, professional bodies and organisations like yourself saying, we recommend this, we recognise, we know that it's been developed rigorously, we contributed, and we're endorsing this as good practice is really important. We really value that. And then the other thing that is really important is, standards and how they're used and how they're incorporated in systems, whether it's in, ICSs or wherever, or acute trust or the GP practice, need to be maintained. That it's not a one-off moment in time. Those need to grow and evolve over time. So one of the important things that we do is maintain that body of standards, so that people can always come to us and say, I don't quite understand this, or what does this guidance mean, or whatever. That's there and support so that the standard can grow and evolve. So moving on. This is, if you have a look at our website, this is the published standards. So there's quite a lot of them now, going right back to things like transfers of care and e-discharge. And particular hobby horse of mine is that, discharge has been around for a long time. if that was successfully implemented everywhere, you know, data flowing from acutes to GPs to community and so on, we'd all be in a really good place. You know, so there's a lot to go for here. And it is true to say that, you know, the implementation of the standards has lagged development. The development is, relatively speaking, the easy bit. But it is really changing now. It is, you know, we've got lots of examples of where it really is being picked up and used and driving real benefit. And I expect that to be a real, you know, self-fulfilling. The more that happens, it's just going to gain more and more momentum. Actually, if we go to the next slide, Alana. Yeah, it's worth just mentioning the core information standard, because of all of our standards, it's the most important one, I think. It's first amongst equals. So the core information standard is the basis. It's like the blueprint, if you like, for the shared care record. So this is what all of the ICSs are being, what integrated care systems are being asked to implement. And generally, you know, this is the holy grail, isn't it? How do we centre care around the person rather than having the hospital's records and the GP's records and so on? How do you have a record that's about Lorraine rather than about the hospital or whatever? So that's a really important one. And it's kind of different in nature, because most of our standards, you think of a care plan or a discharge or something, that's pretty straightforward. And you can understand that's the information that's needed. That's what needs to be collected. That's what needs to flow. With the core information standard, as you can imagine, it's big. There's an awful lot and a very wide variety of information in there. And so it's not, you know, when we first started work on this, people were a bit horrified. You know, particularly clinicians, thinking I'd be overwhelmed by all of this information. And that's not the point here. So it's that the information is available, you know, all of that rich information is available, but what anybody sees at any one time is dependent on, you know, what's the scenario? So is it an accident and emergency, or is it, you know, a GP consultation, or whatever it is, or mental health episode or something? What's the situation? Who is it that's accessing it? You know, what's the valid need to access the information? And indeed, what does the person want to be shared about them is important as well. So moving on. And this is, I just wanted to give you a sense of the kind of things that we're working on. So one of the things, you know, it used to be a few years back, we'd work on 2 or 3 standards a year. As you can see, it's growing really fast. You know, there is no let up in the demand for standards at the moment. And we're just showing some of them here. So we've done an awful lot recently, and really interesting, around personalised care. So the care plan at the heart of that, but you'll hear a bit more later about the About Me standard, really important. Shared decision making, and how does that feed in, and social prescribing. So that's been a really interesting journey. Diabetes, that was our first venture into long-term conditions, and, you know, has sort of blazed a trail in terms of helping our thinking of how we need to do that. You'll be very interested to hear that we're just starting work just now on the maternity standard. So we developed a maternity standard 2 or 3 years ago. So this is an upgrade and refresh and revitalizing of the maternity standard, sort of fairly major overhaul. So it would be great to have your involvement in that. And at the bottom there, interesting one about, quite a different one for us, about the workforce. And how, you know, you may have seen the COVID passport, you know, in time of COVID, and it's building and growing on that, about how do we enable people to come in and rotate between different settings, and whether that's, you know, people, juniors coming in and training, or whatever. How can you make that really simple, effective, safe, and save lots of time, basically? So that's an interesting one to be working on. Okay, next one, thanks. Right, so I wanted to just say a bit more about getting standards implemented. So we do lots of things around getting standards implemented, and our part, you think of professional bodies and organizations like yourselves. What do you care about? You care about quality of care, care about information, you care about safety, typically, you know, and professional experience of care. So you know, we're in a really good position to help and support that drive to get standards implemented, but it is hard. You know, if this was easy, NP Fit would have worked, you know, 10 or 15 years ago. So it is really hard. And we do all sorts of different things. So we're working with the regulators. We're trying to get the regulators to align and, you know, look for evidence of our standards as good evidence in regulation. We're doing toolkits to help people, you know, work at the front line, you know, slides, training materials, case studies, that kind of thing, and so on. But probably one of the most impactful things that we've done is this. It's our standards partner scheme, and we launched this about a year ago. And it's basically saying if we want digitization and standardization of information to happen across the system so that, you know, that information can be shared interoperably, then a really important place to start is with the software suppliers, the system suppliers. And that's what this scheme is about. So we've always involved suppliers in our work. This is about working with them in a much more intense way on a one-to-one basis. So those that want to, they sign up to our scheme. And there's all sorts of things that they get from that. But at the heart of it, they put themselves forward to test their conformance of their systems with standards. So like the care plan or the shared care record or whatever it might be. Which is really important. It's not everything. It doesn't mean that then it's all working perfectly everywhere, but it's a really important step and one of the biggest ways that we can impact moving the agenda forward and getting standardized data shared. So next slide, please. I think this is my last one and I'll hand over to Annette. So what happens basically, and what this shows is that they sign up as a partner, and you'll see in a bit who's signed up. It's been great, the level of interest and the receptiveness of suppliers to work with this has been really great. They've really welcomed it. They like the fact that it's not a judgmental process, it's developmental and about helping them to get to conformance. So they join up as a partner, and then when they've successfully been through and have at least one standard that's conformant, then they become what's known as a quality partner, and they get a badge and there's a quality mark that they can display. And our aspiration is that that quality mark becomes really well understood around the system. So people can know that actually, you know, because nobody else looks, you know, other than self-assessment, which is not really terribly helpful, nobody else is doing this. So it's a real independent, objective, evidence-based assessment of which suppliers are conformant. Sorry, there's a bit of background noise I can hear. Okay, great. So I think I hand over to you at that point, Annette, just to explain a little bit more about how that works.
Hi, good morning, everybody. Yes, thank you very much, Lorraine. That was a really good background to the Standards Partnership Scheme. What we have is, it's a really rigorous and systematic process for assessing IT suppliers and providers when they're ready against implementing the PRSB standards. Now, it is a progressive scheme, so we don't expect people to have the whole standard. The gold standard is having the whole PRSB standard in their systems at the start. So it is incremental, but we have a minimum bar where we would expect a minimum amount of the PRSB standard to be implemented in the system. And the system is, this is the process. And we have a team of assessors, which I lead, which are all clinicians. We have chief nursing information officers and GPs, and hopefully we'll have a paramedic on board soon. So the suppliers are being assessed by clinical experts who understand what you would need in a system to flow information and to record information, and just for communicating information about the person and the patient. So as a starter, we have a lot of interest in the partnership scheme. As Lorraine said, they start off as a partner and then they move on to a quality partner if they want to. So we agree the scope and context of what standard they would like to be assessed against. So far, we've had a lot. We say the personal care and support plan, the About Me standard, e-discharge summary, which is a very common one. And so the first thing we do is when we have done that, we give the suppliers a self-assessment. Now it's quite a rigorous self-assessment where the whole of the standard is on an Excel spreadsheet, and they must assess themselves against every data item on the standard, the functionality, the system functionality that needs to support that standard, and also if all the data items are present and correct. So then it's quite an onerous task. It is quite a big task for the suppliers. So there's a bit of toing and froing. So they will come back to us with queries and we will help them through the process. And then when they're quite satisfied that they have completed the self-assessment, they'll send it back to us. And then we will objectively assess what they have done by reviewing their demo system and working with them. So this is where we differ from other assessment schemes, in that we objectively go and check their system and talk through with them how they have implemented the standard, what's the functionality behind their system. We'll say how it supports, can they get the demographics from the PDS system? Can you hook up, we'll say you have a social care system. How can a nurse check what medications the person is on? So do they hook up to a medication module? Do they hook up to something like TPP for a wider view of the person's care record? So there's a lot of in-depth questions we ask to ensure that it works for an end user. So it works for a nurse or a doctor if they're using one of our standards to care for the patients. And the premise is really that the standard needs to be clinically safe to use, and it also needs to be beneficial, useful. So there's no point in having a bit of a standard implemented and it's actually really no good to the nurse or the doctor or the care worker. So we assess, as I say, a minimum amount of the standard that they need to have in. And then we conclude, it goes through a process where we work with them, we assess them whether they fail or pass. And sometimes you find in reality there are sticking points. It is difficult to have, it's often a new way of working for suppliers. So it's not often straightforward that they will pass. So things that can be sticky, just for example, might be safeguarding, mental health information, legal issues, and things like end-of-life care, bits of information. And again, it's probably because a lot of people are used to more the acute care, and we say GP, but it's again where the social care and mental health isn't so well integrated into IT systems. And this is where it's really important with the PRSB that we have social care, mental health, and a lot of other areas of practice involved. So we highlight the importance of all of these areas of care. Yeah, so they get a quality mark, which the suppliers really like to display a quality mark on their system if they pass one of our standards. And it helps. What's really important about that, I think, for providers and commissioners is that they can look at that and they can see actually the system is compliant with a PRSB standard or a few PRSB standards. So it helps in the procurement so that, you know, people can really assess systems. And also for providers, what kind of a system are you using for your patient care, we'll say in the hospital, what are you using for in care homes? So it has a lot of benefits. Can we move on to the next standard, the next slide, please? And again, I just need to explain this one. The approach is very much progressive and collaborative. So again, it is a bit different than other assessment schemes in that we very much work with the suppliers and providers when they come on board, and we help them implement and conform to the PRSB standards, because it's a different way of working. They're often not that familiar with all the data elements on a standard. They would, as most of you will probably know, they're very good at doing encounters, very good at doing appointments, maybe tasking, IT systems, doing tasks for, and things like that. But again, things like looking at individual requirements, safeguarding, risks, things like that are more difficult. And they do need a lot of help to achieve conformance. And it's been I've worked on this for the last year, and it's a really fulfilling role in that you're helping implementation. And if I could speak about, we'll say, the core information standard. Lorraine has already spoke about it, but it's an example of where we're all working on this together. Shared care records are just being implemented. We really do not understand the big picture on shared care records and how it will work at the end of the day. So us working with suppliers, if they're implementing the core information standard, we're working out the problems together, and we're getting there. We're getting better. They implement the standard, hopefully to a gold standard level, and it's going to work in practice. And I think one of our suppliers, Taffy, who's actually a nurse, explained working with a PRSB in the assessment scheme where we assessed them in implementing About Me and personal care and support plan. And she likened it to yoga practice, where yoga practice is like continuous practice leads to improvement and then betterment. And I think that is kind of the journey. You start off, you need to continuously improve your IT systems so they do work for end users, nurses, doctors, patients, social workers, all care professionals. And I think if we could move on to the next slide. Okay, so this is just an example of the organizations who are joined the partnership scheme. And as you can see, they are acute care providers, our traditional ones like Cerner, Every Life Technology, who I spoke about, Taffy, is their social care. They have a very good system for social care risk management. Nourish social care system. They're all, and then we have TPP, who system ones, which would be more primary care. Orion Share Care Records. There's a lot of them you will know probably them better than I do. Person-centered care and other social care provider. And we have worked with a lot of these, assessing some of the standards. And as I say, it's really great to work together. And we will come to how you can help us and how you can join the PRSB and work, help us on this journey with the Standards Partnership Scheme. Because again, standards are no good unless they're implemented and used and workable. So I think, can we move on to the next slide? Okay, and I think just to say, I think some of my colleagues are in the audience who are assessors, Ian and Matt, two nurses who are join me as assessors. And if they're there, really just to say that it's a really great team we have.
Right, they're welcome to, I don't know if they wanted to introduce themselves.
Yeah, I don't know.
Sorry to put you on the spot, if not, we understand.
Yeah, well, I'll just say we have Ian Woodburn and Matt Butler, and they're both CNIOs. Matt's a mental health nurse, and Ian's worked everywhere, I think. He's now in acute care, but he was a community matron, worked in primary care, in NHS Direct. I think, like most of us, we get around.
Mm. Can I just chip in there as well to say, as the scheme grows, which it really is doing, it's something your members might be interested in getting involved in, doing some assessment work. We're really keen to involve people more widely as that grows. So just a thought.
That was one of my questions for the end. How can our audience get involved? So we'll talk a bit more.
Okay.
So I think this partnership going. Right.
Yeah. So I think we're moving now to why our information standards important for nursing. So Claire and myself will be talking about that. And I think this just slide is to reiterate the breadth and depth of our standards. Improve safety and effectiveness. I did speak about the e-discharge summary. We have also mental health discharge summary. Those that you saw on a slide earlier, outpatient's letter, there are a lot of transfers of care. And these are things that I think were traditional standards. We developed them early because everybody knows about them. Everybody understands a discharge summary. Everybody understands an outpatient letter. So those were quite good ones to start with. But again, we've moved on. And most recently, that on the right, we have personalised care. And I think one of our major achievements was the personal care and support plan, which, if some of you might know about this, it was a digital care and support plan prior to that. But we have brought in more of the mental health. And this is nurses, we get a bit, care planning is a big topic, and it's confusing because everybody does care planning. The GPs do some preventive care planning. Nurses, it's like your bread and butter, plans of care. So this is more different to plans of care, a management plan, in that it's a plan for the whole team. So this is specifically for people who have long-term conditions or complex needs. So it's to ensure that all actors that are involved in the person's care are involved, and all their actions and work is collaborative. So it's kind of an initiative and a live document that you would work on together. So if we say the person is having, we'll say, physiotherapy and maybe having some cognitive behavior therapy. So you would be able to see from the care plan the input from your physiotherapist, from your psychologist, from your maybe social prescribing. So it's a way of, it's very much for the person and to ensure that they're in control of their care plan and that everybody is working together. And there should only really be one care plan. And we'll say our nursing management plans would actually feed into this. So we'll say you have, maybe the person has some wound care or falls problems. So there would be, you know, care plans and documents that would feed into that care plan. But the idea is there should be only one live care plan on the go at one time. And this is an area where we've been, suppliers are very interested in this, in getting this implemented in their system. And it's been quite successful so far. Again, there's always been sticky bits, but we've worked through that with the suppliers. And the other areas, we have integrated care records, shared care records, we say is a big topic at the moment. And again, it's very much on a journey of us working with IT suppliers and providers to work together. And the other area, I think is quite an apt one here, is support COVID and flu vaccinations. So I think this shows where some of our standards can be very flexible. And we are at the PRSB on top of, we'll say, we get involved in things that are topical at the moment and critical. So if we have critical standards that needed to move forward through the pandemic, like pharmacy standards and vaccination records, how they were, the messaging going from, we'll say, from GPs or pharmacies to GPs or whatever, we were very much involved in that. So we do get involved and can do topics and issues that need to be worked on immediately. And so I think that's about it. The other area we're working in, which we'll come on later, is we're working in the nursing standard. So it's nursing assessment documentation. So we can come on to that a bit later. And Claire, I'll hand over to you for the About Me standard.
Thanks, Annette. Hi, everybody. I'm Claire Sutton. I'm a registered nurse and digital transformation lead at the National Care Forum. I'm also a non-exec director of the PRSB, which is why I'm here today. And I wanted to give you some information about, and basically it's my favourite standard, which might sound a bit sad having a favourite standard, but I think that About Me is so important across every aspect of health and social care. I'm going to start by just asking Athena to play this video, because Sam, who is Shane's mum, explains it absolutely brilliantly, and then I'll talk a little bit more about it.
I've got two sons. Daniel is almost 18 and Shane, who's 21. He's very funny. You know, I think about 3 years ago he started to develop this really fun sense of humour, and he's also the most affectionate person I know. It's so lovely when I go in and call him in the morning and the first thing he does is give me a big hug. He's really proud when he's able to do something on his own, and sometimes he'll push me away because it's like, no mom, this, you know, I can do this myself. And sometimes he'll sit on the top stair and then he'll call me. Shane can say mama, it's the only word he can say. And what he wants is me to sit beside him and give him a hug. And it just starts my day in such a positive way. After that, Shane goes to his annex. He's there between the hours of 9 and 4 every day, and he's supported by Max, and at various times during the week we have a 2-to-1 support which enables Shane to access the community safely. Shane starts every day with a tack pack session. This is really great for Shane to have his sensory needs met, and he always feels happy and relaxed afterwards. 3 times a week Shane does what we call the big walk. The walk is up to 3 miles long. On the way Shane will stop and smell flowers, touch trees, and some days he will pop into our local co-op and buy his ingredients for a baking activity. After Shane was born, about 25 hours later he started to have a seizure, and he ended up in intensive care. Shane had meningitis. He spent a little over a month in hospital, and on discharge he was diagnosed with cerebral palsy. When Shane was 8 months old, he got diagnosed with optic nerve damage and cortical visual impairment. Shane is registered blind, and cognitively he's about 2.5 to 3 years old.
Ready, Shane? Yeah.
As a parent of a young person with complex needs, it's really important for us that those who work with Shane, they understand him as a person. Yes, his diagnosis and his health needs are important, but they're not as important as what's important to Shane. They have to see him first and his disability second. Before we employ new people, we always share Shane's wiki. Shane's wiki is very comprehensive and it covers lots of information about our family, Shane's health needs, but most importantly about Shane as a person, what he likes, what he dislikes, what makes him happy, how he interacts with people, and they get a really good picture and an insight into how best to support Shane, but also when not to support him. Just pulling up a zip on his coat, that's independence for him because it's a skill he's learned, and we don't want somebody doing that for them. This is the type of information you're not going to get on a medical report, but by having everything in one place, new people coming to work with Shane will get that insight before they start. I'm almost like preparing for the future, preparing for a time that I really find quite hard to think about, a time in the future when I'll no longer be here. Having all of that information in one place means that when I'm no longer here, that can be passed on to whoever looks after Shane. I'm really proud and happy to say Shane is one of the happiest people I know. Now that his needs are met, he's stimulated, he's surrounded by people who love him, and he's supported by those who really understand him as a person and what's important to him.
Thank you. So I think that's a really, really powerful video that demonstrates just how important a standard like About Me
Can
is.
recover. There are steps we can all take to bring life
I
back.
might need to stop the video. That's it. Back to you.
Don't know
Claire.
if that was me.
Oh.
I don't know, it just came from somewhere. So yeah, I think that video really demonstrates to me, and hopefully to you here, that it's so important and so powerful for us to be able to share that information about what really matters to an individual. Now, we're all nurses, we're all midwives, we're all professionals that have come across people in our professional lives where we would have found our jobs to be much easier, and we would have found that we were delivering better care to those people that we were supporting if we'd known these things. And it's not just applicable to people who've got really complex needs, it's applicable to everybody. If we have the information that's held in About Me about absolutely every person that we support, we could give really great care to those people. And it can be something really simple about, you know, how does somebody prefer to be addressed? That really matters. If somebody always drinks their drink in a blue plastic cup, and they go into hospital and they're given their water in a white mug, they're going to get dehydrated very quickly, and they're going to end up unwell really quickly. And that's the sort of information that can be held within About Me. And the really important thing about the About Me standard is that it's owned and produced by the person, and it can be held in any format. So you saw in the video Shane's wiki, so a lot of his information is presented on that device. So it can be done as videos, it can be done as sound recordings, it can be done as written text. But what's really important is that it's about that individual and those things that matter most to them. So it's how they like to be communicated with. What things do they do that's really meaningful for them? So in Shane's case, he starts every day with a sensory activity. If he didn't have that sensory activity, that's going to really impact him for the rest of the day. Now, if Shane finds himself in a situation where he's admitted into hospital and he's requiring care by people that are not his usual carers, not people that know him really well, then by them having access to the About Me information, that means that they can tailor the care that they are delivering to deliver it in a way that's really impactful and really meaningful and really positive for Shane. So I think that the reason why it's my favourite standard is because it's absolutely about that person at the centre, and it's applicable to every single person that we support in every single setting that we support them. It's very tailored for people who've got very complex needs, but actually all of us have got those preferences. All of us have got things that actually we think, I wish that had been done like that. And it can be really, really silly things. But actually, if we can share that with everybody that we're encountering throughout our journey across health and social care as patients, as individuals, then we can really make sure that the care that we're receiving and that we're giving is absolutely outstanding at all levels. So the reason why the standard is so great is because it defines for us as professionals how this information should be documented and shared across people's health and care records. So instead of people coming along and just giving you a list of things that are really important to them, it's a standard that enables that information to be shared, so that actually in this wonderful idyllic ideal world, we're going to be able to share that information across, and the individual isn't going to have to tell us every single encounter, every single time they come across another clinician, what those things are that are important to them, because they've done it once and it can be shared because there's a standard in place to do that. So if you go on to the next slide for me, this is a fantastic example of where About Me actually works in practice, where it's been implemented, where it's built in. And the urgent transfer of care from care homes to hospital standards is using the red bag scheme. So you might be aware of the red bag scheme. It's essentially a red bag whereby if a resident of a care home has to go into hospital, be that a planned or an unplanned admission, that they can send that information across, and the people in the hospital understand what that person's needs are. And that's where About Me would sit really, really well. Now, the e-red bag is about transferring that information electronically rather than a piece of paper in the red bag. So it keeps all that information about somebody and those things that matter and their health needs and their care needs in one place during that transfer across. It's been utilised really well in South West London, and it has shown some really, really good results. So there's been an 11% reduction in those emergency department attendances and a reduction in lengths of stay. And that's because people are able to understand what they need to do and tailor that care and deliver the best care to the needs of that person. Okay, so I'm going to hand back to Annette now, who's going to just give some information about one of the standards.
Annette, I'm just wondering if we're a little bit short of time and we might run out of time for
exactly.
Yeah, should we skip on? Yeah, we'll do that one another day. So we just wanted to
again.
we just wanted to finish on, you know, hopefully you can see, if you didn't know before, why it's important work and why it's so critical that people like yourselves are involved, you know, closely involved in that work in lots of different ways. So if you could go to the last slide, Athena. There's lots of ways. So when we run a project, whether it's the nursing standard or whatever, we will have somebody who's the lead for the, you know, the profession or most relevant professions to come in and work closely as part of the project team. That's a way to be involved as part of the main, you know, when I talked about us collaborating and consulting really widely, it can be hundreds and thousands of people take part in those consultations. Always delighted to have you know, more, and definitely nurses. You know, we work hard to recruit nurses to be involved in those, whether it's the workshops or webinars or surveys. Claire's a Ned. I haven't got that many gaps at the moment, but that's another opportunity, I guess. Blogging, awareness raising, just knowing about what we do and promoting it, asking the questions. If you probably work in trusts and so on, asking those questions, you know, helping us to raise that awareness, that would be great. And I think what we want to do when we send out the slides from this is we'll put our newsletter. That's a really good way, actually, just once a month, keeping in touch with the real highlights. And as we said at the beginning, Lucy will be your representative in that, so that's a channel too. We are hot off the press. We are launching a professional network as well, which is like for, as well as the bodies that you saw, you know, that are our members, and communicating through them. It's for individuals who have a particular interest in standards. So that will be coming soon, and we'll definitely keep you posted on that. But keen to hear more from you, not us talking at you for too long. So really happy to take any questions.
Thanks, Lorraine, Annette and Claire. What a wonderful presentation, and a really poignant video as well. It brings it all to life, that strong narrative, doesn't it? It
does.
I wondered if you would mind unsharing your screen, because it's always lovely to see everyone's faces.
Yes, agreed.
Wonderful. And if people feel comfortable, please do turn your cameras on. It's always lovely to see you and have that interaction. So I know Ollie's just messaged me. Ollie's got a question for you. Ollie Endicott from Ren Healthcare on home and a community standard. So Ollie, over to you.
Thanks, Lucy. Hi, Lorraine. My name's Ollie. I'm the head of nursing at Ren Healthcare. In essence, we're a fairly young company. We're clinical home care, and we see patients in various guises. We see patients on behalf of the NHS, private, and with charities as well. But the one thing that we find sometimes working in that private sector, the information can sometimes be slow to filter through from NHS back into that private service. And I totally understand why that happens, because of the time demands and how those services run. But I think for us, sometimes in that private sector, obviously we're seeing patients on behalf of the NHS. So it's really important that we're able to have obviously key information sent across to us. And I think sometimes the only way that the information filters through is via email, and then obviously you only get maybe half a picture, or sometimes only the key information. But as we saw from that video, sometimes it's that more holistic picture that really builds up that better standard of care, if you like. So, you know, just wondering if there's any plans within your services to try and link in those kind of clinical home care teams that obviously still service those NHS patients. And I suppose really, if you look at it, I suppose sometimes we see those patients more frequently than they would actually do in the clinics and hospitals. So, you know, with those kind of eyes and ears for those referral centres, if you like.
I thought your question was going to be slightly different, Ollie. Let me answer what I was going to say, and then we'll see if I've covered what you're on. You threw me a little bit at the end there. So I thought you were going to ask more about, you know, the standards in the private sector, in the independent sector, and it is important. It's a good to understand that. So the standards are available. You know, they're recommended by the colleges and all of our members, and people take notice of that, and they're available to everyone to use. But their status is they're recommended. They're not enforced. Come back and say a bit more about that in a minute. But they're available, and clearly, if the NHS is commissioning services from private providers, then you know that conformance with standards can be imposed. What we haven't done is yet, you know, we're on a journey with the NHS and social care, and there's a lot to, you know, we're right in the foothills at the beginning of that journey. So we've had that conversation quite a few times, and we would love to tackle that, but we haven't yet. It's sort of not got to the top of the pile yet because there's such a lot to do. But I'm not sure that completely addresses your question, Ollie. You might need to reframe that for me, or I might need my colleagues to help me. So does that cover it?
It kind of does, Lorraine. I think really what I was looking for is the way, obviously, that the information filters down to us in that private sector, but also how we filter information back into the NHS. Obviously,
yeah.
we do stuff like patient visit forms,
yeah.
but I think probably that's sometimes quite a narrow scope, because
yeah.
you're only kind of looking at that patient on that day. We're not looking at the bigger picture sometimes. So
yeah,
I think it kind of encapsulates.
So that for me, Ollie, that's defining interoperability and why we need it. So I don't think the challenge is particularly different to, you know, we talk a lot of the time about health and social care and how do they integrate in the same way, you know, people going from care homes into the acute hospital or whatever. Mm-hmm. And that, you know, the same point about we are on a journey and this is all going to take some time, but we're all going the right way, you know, if we agree what the standard is. If the system suppliers conform, that helps, because they're, you know, for the reasons I was explaining earlier, that sort of pervades the system then. And if you're coding, counting, recording that information in the same way, then it can be shared. And then, you know, things like, you know, how services are commissioned, what levers are, you know, brought to bear in terms of encouraging that behaviour and so on. It all starts to be possible. And I think gradually, incrementally, that's the change that you'll see starting to happen.
Lovely, thank you.
Lorraine, I think Claire had a hand up and Helene.
Sorry, I can't see that
as well. No, you're fine. I think you wanted to support.
I popped it in the chat. All I was going to say, Lorraine said it anyway, it was just basically encourage your system suppliers to adopt the standards, because if the tech is in place to be able to do it, then it's so much easier to be able to say to your health and social care partners, we've got it in place to share it, you've got it in place to share it, let's share it.
So just from my understanding, really, so it's ensuring that you've got those electronic patient records in place to then share information more readily. So do you have a suite of standards in place for home care, or is that something you're looking to develop? Because I'm just thinking there may be a segue with Ollie and the team to help support with those standards if they're not in place.
Do you want me to come in, Lorraine?
Yeah, go ahead. Yeah, go ahead.
We do have, a couple of years ago, we developed about 5 standards with social care, and one of them is only actually referral from hospital to community care, and it's much more detailed in the e-discharge, which would go to the GP. So it's a standard which would go about what packages of care the person needs. So it could be from NHS care, or it could be a social care for a local authority. So that's quite a detailed one. But I don't think that's, as I say, been implemented that well yet, because it's NHS digital. So all the systems, like Lorraine says, need to work together. So it's actually, I think, for you and people like out there to drive them, say we want this standard in, because we all know the e-discharge is very, it is basically for a GP, from acute to GP, and you're all CCD, but this is better. Then we have the care home, we have the core information standard, and there is a local authority view for that. So that should have all this kind of information, like what the person's support reason is, all the packages of care. And I think pushing that as well, and that's probably a better way, in that shared care standards are being implemented around the country. So say we really need the core information standard in place. There is a care home view in that should be available for local authorities. And to be frank, with our conversations, a lot of them people don't know. It's like somebody said to me, well, it's really difficult to know what you need in an EPR system. So people need help actually. And I think the standards give you organize, standardize information for this, we'll say, information flow or this documentation type. So it helps people out and because it is an enormous task to know what you need in your EPR system, what's going to work.
And one of the things, Lucy, an important part of your role and ours is hearing from our members where are the gaps and where else are standards needed. And, and one of the things that we can do is influence the system and, get the funding and get that developed. And we have said actually for some time that we think domiciliary care, I think there's things that could be adapted quite easily and bits of it are addressed, but actually we think that's a bit of a gap. And the other
interestingly, I guess within home, but just to Ollie's point, they do a lot of complex care needs at home now, don't we?
Yes,
so a lot of
indeed.
Complex IV therapies and chemotherapy that you would ordinarily see in the hospital. So it's just thinking about how that can. So welcome to feedback at the next board meeting, absolutely. And Ollie probably catch up with you outside of this as well, if that's okay.
Thank you very much.
Don't want to take too much of the question time up. Has anyone else got any questions for the team? We've got five minutes or so. Any questions? Anyone else want to ask? If you want to get involved, which would be great to get more organisations signed up and involved with the PRSB. Any comments? If you don't feel comfortable asking a question, please do pop it in the chat box.
Really interesting to know if it kind of makes sense, because you can pitch it too high or too low, and people have widely varying.
We've got Shanti just do it. So Shanti, welcome. You just take yourself on mute. Oh, they've gone again. Was that a mistake? No. A mistake hand potentially. Okay. Okay. Well, what's really interesting is in a few months' time, you'll be, as you said earlier, Lorraine, you'll be launching some new nursing standards, which we're going to be having a separate webinar on. Going to share. That's going to be later in the summer, isn't it? So we'll keep an eye out for the dates around that. Any other questions for anybody else? Oh, just see if there's any other comments in the chat box. Oh, we've got Sean Thomas said very interested in the About Me standard. Great. Great.
Can I chip in on that one?
Please
Sean?
Please do.
Hot off the press, and only you know this because we haven't announced it. Is we're going to have a campaign around the About Me standard starting fairly soon, because we think it's so important, and that the impact of that standard, as Claire was describing, is just enormous. So any help and support in that, we'd really welcome it. So let us know your interest.
Can I just add to that, Lorraine? What we'd really be interested in is kind of, spokespeople amongst clinicians and so forth, who can really tell their story about why they think it's important to have that information. And they can tell it in any number of ways, a video, a blog, all sorts of things, events and so forth. If you're having events, that we would be able to include that in. So we'd be really happy to talk to you about that and see if we can work together on it.
That's great. Thanks, Elaine. A really good point is actually bringing it to life through that patient journey like you did with the video. It's so important, really hits home. Thanks, Sean. Thanks, Sean. Anybody else have any questions or comments before we finish up for today? Oh, Hayley really likes the standards. The trust she works at isn't digital. I think we're seeing that, aren't we, Hayley, across the board, aren't we? Still not got EPR systems. Let's hope and dream that we'll get there one day. It'd be great to have that.
Well, yeah.
That communication across all trusts and organisations, across the whole ICS and whole systems would be wonderful. We'll get there, won't we? We'll get there. I guess I'm just looking at the time. We need to finish up. But I just want to say a huge thank you to the PRSB for joining us today. It's really great to welcome you. I'm really feel quite privileged to be part of your organisation as well. If you've got any questions you think about on reflection, please do get in touch. We'll share the slides from today, the links, more about the About Me standard as well. Claire, fantastic to share that with everybody. I think it really brought it to life. And if you've got any questions, please do link in with me. I'm happy to take them back to the advisory board. How can we support you and your organisations to standardise our approach to care and ultimately impacting on our patient outcomes and population health? So please do link in with me. I'm happy to. Or if you'd like to get involved, please do contact me or the PRSB. It's just really great to raise awareness of the great work that are doing to standardise our approach to care. So thank you all. Thanks for joining us.
Thank you very much.
This has been recorded. So if you wish to pick it up, share it with your colleagues, please do. And there's lots of links in the chat box as well, so please do take them, but we'll include them in the email follow-up as well. But thank you for joining, and we look forward to seeing you soon. Thanks Lorraine,
Lucy.
and Annette.
Thank you.